I'm speaking with Dr. Daniel Furst, renowned professor of rheumatology at University of Washington, University of Florence, UCLA. Dr. Furst, pattern recognition, one thing that dermatology and rheumatology share is pattern recognition is really central to the diagnostic skills in both. What is an important lesson that dermatologists could take about recognizing patterns in rheumatologic diseases?
So there are multiple patterns one has to examine, but one of the important ones is the idea of polyarticular versus monoarticular disease. Among the monoarticular diseases, if you understand just 3 or 4 of them, you'll get 80% of the problem. You have to think about rheumatoid arthritis, osteoarthritis, you have to think about autoimmune diseases, and you have to think about gout and crystalline diseases. If you remember those 4 diseases, you'll have encompassed about 80% of the cases with polyarticular arthritis.
What are the clues that help you narrow it down to those 4?
Well, one of the most important things are pattern, pattern, pattern. And when you think about it, osteoarthritis and gout will be asymmetric, whereas autoimmune diseases and lupus and RA will be symmetrical diseases. So symmetry versus asymmetry. Upper versus lower, that is lower tends to be more gout and more OA. Upper, more autoimmune diseases and RA.
And lab tests?
Lab tests are both good and bad. The list of possible high, normal, etc. are remarkable. I think if you think about inflammatory diseases, think CRP and ESR. And when you think about elevated and normal ESR and CRP, the thing to remember is that viral diseases and things like osteoarthritis, generally more non-inflammatory, will have normal ESRs and CRPs, and those that are inflammatory, metastatic cancer, infection, rheumatoid arthritis, which are very inflammatory, will have high levels of these. There are a few exceptions, but they're not particularly common.
So basically, you've just given the short course of rheumatology for non-rheumatologists?
Well, as I say, you don't have to be Einstein to be a rheumatologist. Just remember some simple stuff.